Hi, I'm Tracy Brown, the CEO of the American Diabetes Association.
And I'm Dr. Ken Moritsugu, the Interim Chief Science and Medical Officer of the American Diabetes Association.
As we continue to track COVID-19, our employees, those that we serve, our communities continue to be of the utmost importance from a safety perspective. And as we talked about that COVID-19 is evolving and fluid, as we get more information, we are going to share that information with you. And so I've asked Dr. Ken to share with us some of the newest information that we have. Dr. Ken?
Thank you, Tracy. As we have always been talking about, make no bones about it. COVID-19 is serious. It's a serious challenge to our society and to our personal and community health. Information continues to come in. And as information comes in, our conclusions and our data and our recommendations also evolve. To date, there are about 1,500 individuals in the United States who have been diagnosed with COVID-19, and about 35 people have died from that disease. But today, I'd like to put social distancing into a little bit better context for you. Social distancing is really meant to address two major issues. One is your personal health and safety, and the second is a community capacity to respond. With regard to your personal health and protection, what you want to do is make sure that you are not in anybody's face when you are interacting. So remain about 6 feet away, about the distance between Tracy and myself. If you are testifying in front of a legislature, don't hang around in a large crowded room, but rather use a surgical approach. Get in, do your business, and leave. With regard to the second aspect, protecting the community capacity to respond, I'd like to point you to this graph here. This line represents the community capacity to respond. This tall spike is if suddenly the community were faced with a huge onslaught of individuals with COVID-19. This red line represents what would happen if we tried to slow down the transmission and the attack of COVID-19 on our population. The areas under both of these curves are approximately the same, but you can see that in the first, if there is a spike, that will quickly overwhelm our community capacity to respond. And if it were attenuated here, it's much better, and our community will be able to respond much better. Thank you, Tracy.
Thank you. And so, Dr. Ken, one of the other things that we continue to hear through media of all kind is that people living with diabetes are in the high risk category. Can you explain to us, what does that mean exactly?
Thank you, Tracy. The International Diabetes Federation has come up with a response to that question, which I think is right on point. Those of us who live with diabetes, Tracy, myself, and many of those whom we serve, are challenged every day. And when we become ill, are really ill-equipped to respond as well as somebody who is healthy without diabetes. That challenge makes an infection with COVID-19 even more dangerous to our health and well-being. The second aspect is that when we get ill, think about it when you have your sick days, your sugars are all over the place. And being able to respond adequately is dependent upon knowing where your sugars are and being able to respond adequately.
And so with this new information that Dr. Ken has shared, this is about us reducing the spreading and the contamination associated with COVID-19. That's why you see more schools closing, businesses closing, the NBA and other athletic teams shutting down, and Disney is an example. They have now shut down the first time since 9/11. They're not doing this to cause panic. They're doing this to help us apply social distancing and reduce the spreading and contamination. So again, we wanted to share this information so that you can have it and make decisions that will allow you to stay safe, your family, your communities, but more importantly, our role to minimize the spread and contamination. So thank you.
Thank you.